Hi, I'm Montgomery Township Mayor Sadaf Jaffer, and I have a COVID-19 update for June 1st, 2020. As of 9 a.m. today, 108 Montgomery residents have tested positive for COVID-19, and 7 community members have died. We have 75 cases that are presumed recovered. Governor Murphy has indicated that we are entering stage 2 of our response to COVID-19 as infection and fatality rates fall throughout New Jersey. We will be providing more details on what that means in the days and weeks to come. Yet there is another crisis that is hurting our community and communities throughout this country. That is a crisis of racism. We are currently witnessing moral outrage all over the country against the tragic murder of George Floyd by a Minneapolis police officer as one example of the racism experienced by Black Americans and the impact of racism on their health and well-being. I strongly condemn anti-Black racism, and in my efforts to educate myself, I am indebted to members of the Black community in Montgomery for their honesty. I have heard their fears and seen their tears. It has made it clear to me that I must do more as a leader to combat racism and prejudice. In this week's video, I would like to take some time to address racism as a public health crisis. The information I'm providing here is from the CDC on COVID-19 in racial and ethnic minority groups and a resolution that was recently passed by King County, Ohio, declaring racism a public health crisis. We cannot understand the COVID-19 health emergency in isolation. Data indicates that Black New Jerseyans are dying at a disproportionately higher rate from COVID-19 than their counterparts from other racial groups. Though race is a social construct with no biological basis, it is a social reality that shapes our lives. Systemic racism structures opportunity and assigns value based on race, which unfairly disadvantages specific individuals and communities and unfairly provides advantages to other individuals and communities. Factors that influence racial and ethnic minority group health are often related to living conditions and work circumstances. Research suggests that racial residential segregation is a fundamental cause of health disparities. For example, many members of racial and ethnic minorities groups live in neighborhoods that are farther from grocery stores and medical facilities, making it more difficult to receive care if sick and stock up on supplies that would allow them to stay home. Racial and ethnic minority groups are overrepresented in jails, prisons, and detention centers, which have specific risks due to congregate living, shared food service, and more. In terms of work circumstances, the risk of infection may be greater for workers in essential industries who continue to work outside the home despite outbreaks in their communities, including some people who may need to continue working in those jobs because of their economic circumstances. Nearly a quarter of employed Hispanic and Black workers are employed in service industry jobs, compared to 16% of non-Hispanic white workers. In all age groups, Black Americans are more likely than white Americans to report not being able to see a doctor in the past year because of cost. Stigma and systemic inequalities may undermine prevention efforts, increase levels of chronic and toxic stress, and ultimately sustain health and healthcare disparities. As I've discussed in previous mayor's updates, the COVID-19 health emergency has brought to the fore some of the best parts of our society, like the commitment of many of our neighbors in Montgomery to serve and take care of each other. Yet it has also revealed our demons and unhealed wounds, like the continuing scourge of racism. Racial justice is a value that is very dear to my heart, and as an elected official, I hope to be actively anti-racist in word and deed. I'd like to close this video with a poem by Audre Lorde, who identified as a Black feminist lesbian poet. This poem is entitled A Litany for Survival. For those of us who live at the shoreline, standing upon the constant edges of decision, crucial and alone, For those of us who cannot indulge the passing dreams of choice, who love in doorways coming and going, in the hours between dawns, looking inward and outward, at once before and after, seeking a now that can breed futures, like bread in our children's mouths, so their dreams will not reflect the death of ours. For those of us who were imprinted with fear, like a faint line in the center of our foreheads, learning to be afraid with our mother's milk. For by this weapon, this illusion of some safety to be found, the heavy-footed hope to silence us. For all of us, this instant and this triumph, we were never meant to survive. And when the sun rises, we are afraid it might not remain. When the sun sets, we are afraid it might not rise in the morning. When our stomachs are full, we are afraid of indigestion. When our stomachs are empty, we are afraid we may never eat again. When we are loved, we are afraid love will vanish. When we are alone, we are afraid love will never return. And when we speak, we are afraid our words will not be heard nor welcomed. But when we are silent, we are still afraid. So it is better to speak, remembering we were never meant to survive. I express my solidarity with all who have and who are experiencing injustice, and I appreciate the bravery it takes to speak out against it. I hope that we can continue to work towards building a community in Montgomery where all people can not only survive, but thrive. Take care.